So, good morning, friends. In this session, I'll be discussing about the topic spinal cord. Okay, and I'll be dealing in detail regarding the spinal cord, the external features, and all the aspect which is present in this video. So, the first point written here, it's written that under the external features. What is spinal cord? Spinal cord is nothing but it is a cylindrical bundle of nerve fibers and associated tissue. So if you look into this is a spinal cord. Okay. Spinal cord is nothing but it is a cylindrical bundle of nerve fibers and associated tissue. And we're going to discuss about this spinal cord in detail. And the first point written here is external features. Okay. In the external features, we need to understand the level of spinal cord in the adults, level of spinal cord in the newborn. So the first point written here is the level of spinal cord starts from the C1 to the lower border of L1. Okay, it's an important question here. Where does it start? It starts from the C1. Okay, it starts from the C1 vertebrae. You have gotten vertebrae. Okay, that we'll be discussing. But if you want now itself, so we have a vertebrae like this. Okay, you have got a cervical vertebrae, you have got a thoracic vertebrae, you have a lumbar vertebrae, and you have got a sacral vertebrae. In the cervical vertebrae, you have got C1, C2, C3, C4, C5, C5, C6, C7, right? In the thoracic, you have gotten 12, T1, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, T12. In the lumbar, you have 5, L1, L2, L3, L4, L5. And you have in sacral, you have S1, S2, S3, S4, S5. And you have got a next one that is coccygeal vertebrae. Alright? But the point which we need to discuss here is in the adult, okay, in the adult, the spinal cord starts from the C1. This is a C1. Okay. It starts from the C1 and it ends at L1. Where exactly at the L1? If you observe carefully, this is L1. This is a lower border of L1. Okay. Lower border of L1. And the next important point written here is what is the level of spinal cord in the newborn? The level of spinal cord in the newborn is it starts from the C1. Observe carefully. It starts from the C1, right? It starts from the C1 and it ends. Where exactly it ends? It ends at the upper border of L3. Upper border of L3. This is an L1 vertebrae, L2 vertebrae, L3 vertebrae. So during the birth in the newborn, the spinal cord which is present from the C1 vertebrae to the upper border of L3. This is an L3. Okay, upper border of L3. As the time proceeds, okay, now the level from the L3, remember, it goes to the lower border of L1. Okay, lower border of L1. That's a basic point you need to understand. And if you look into the points written here, if you look into this beautiful diagram, this is a medulla oblongata, this is C1, and you can look into this, you have got something known as cervical enlargements. Remember, you have got a cervical enlargement, and you have got something known as posterior median sulcus, posterior intermediate sulcus, posterior lateral sulcus, and it's also written that lumbar enlargement, L2 to S3, and you have got a conus medullaris, and you have gotten something known as dural sheet, and you have got phylum terminale, and you have got something known as coccyx. Now what is it trying to tell us is the first important point, right? I want to show you the posterior or the first anterior aspect of the spinal cord. Okay, when I show you this is an anterior aspect of the spinal cord, right? You're seeing from front angle. You have got two important points here. You have a fissure which is present in the medians. This is an anterior median fissure. And you even have a fissure which is present in the lateral aspect. What is this? This is an anterior lateral sulcus. What is this? This is an anterior medial fissure. And this is an anterior lateral sulcus. these two fissure and the sulcus which is present in the anterior aspects. Okay, and the same thing if you look into the, if you turn the spinal cord and if you look into the posterior aspect, and you have got a median sulcus which is present in the medial aspect, that is a posterior median sulcus, and you have a posterior intermediate sulcus, and you have a sulcus which is present in the lateral aspect, that is a posterior lateral sulcus, right? So this is the which is present in the median sulcus, which is present in between the median and the lateral, this is an intermediate sulcus, and you have a lateral aspect, this is a lateral sulcus, right? So these both 2 points are very important here. The same thing, it's written here, anterior median sulcus and anterior lateral sulcus. In the posterior aspect, you have an anterior median sulcus, intermediate sulcus, and the lateral sulcus. Okay, and if you observe carefully, we'll be discussing in detail. You have got something known as conus, which is present here. This is something known as conus medullaris. We will be discussing in details. And you have got, this is a dural sheet. Okay, dural sheet, and you have a phylum terminale, and you have a coccus. We'll be discussing that in the further session in detail. Thank you.